Good day everyone! My name is Princess Julia E. De La Paz, a Level 2 student nurse, batch 24 from Nueva Ecija University of Science and Technology, and today, I will be performing the Foley Catheter Insertion. The goals of the Foley Catheter Insertion are to relieve discomfort due to bladder distension or to provide gradual decompression of a distended bladder, to assess the amount of residual urine if the bladder empties incompletely, to obtain a sterile urine specimen, to empty the bladder completely prior to surgery, and to facilitate accurate measurement of urinary output for critically ill clients whose output needs to be monitored RD. The assessment are determine the most appropriate method of catheterization based on the purpose and any criteria specified in the order, such as total amount of urine to be removed or size of catheter to be used. Number 2, use a straight catheter if only a one-time urine specimen is needed. Number 3, use an indwelling or retention catheter if the bladder must remain empty. Number 4, assess the client's overall condition. Determine if the client is able to participate and hold still during the procedure. Number 5, determine the client's last voided or was last catheterized. And number 6, if catheterization is being performed because the client has been unable to void, when possible, complete a bladder scan to assess the amount of urine present in the bladder. In planning, allow adequate time to perform the catheterization. Although the entire procedure can require as little as 15 minutes, several sources of difficulty could result in much longer period of time. And last number, some clients may feel uncomfortable being catheterized by nurses of opposite gender. If this is the case, obtain the client's permission. The equipments are sterile gloves, waterproof drapes, antiseptic solution, cleansing balls, forceps, water-soluble lubricants, urine receptacle, and specimen container. Prior to performing the procedure, greet your client, introduce yourself, verify your client, and explain what are you going to do and why is it necessary. The rationale of this procedure is to build rapport and to reduce the anxiety of the patient. Good day, my name is Princess Julia E. De La Paz. What is your name, please?
Princess Alexandra D. Pinakano.
And may I know, what should I call you?
Ma'am Princess.
Okay, so now, Ma'am Princess, we will do the Foley catheter insertion. Is that okay with you?
Yes.
Perform hand hygiene and observe the appropriate infection control procedure. Provides client privacy by drawing the curtains or closing the door. Place the client in the appropriate position and drape all areas except the perineum. The female position are supine with knees flexed about 2 feet apart and hips slightly externally rotated. Establish adequate lighting. Stand on the client's right if you are right-handed, on the client's left if you are left-handed. And if using a collecting bag and it is not contained within the catheterization kit, open the drainage package and place the end of tubing within the reach. Open the catheterization kit. Place a waterproof drape under the buttocks of client without contaminating the center of the drape with your hands. apply sterile gloves. Organize the remaining supplies. Saturate the cleansing balls with the antiseptic solution, open the lubricant package, and remove the specimen container and place it nearby with the lid loosely on top. Attach the refilled syringe to the indwelling catheter inflation hub. Apply agency policy regarding pretesting of the balloon. Lubricate the catheter 2.5 to 5 centimeters or 1 to 2 inches for females and place it with the drainage and inside the collection container. If desired, place the fenestrated drape over the perineum, exposing the urinary meatus. Cleanse the meatus. The non-dominant hand is considered contaminated once it touches the client's skin. Insert the catheter. Grasp the catheter firmly 5 to 7.5 centimeters or 2 to 3 inches from the tip. Ask the client to take a slow, deep breath and insert as the client exhales. Slight resistance is expected as the catheter passes through the sphincter. Advance the catheter 5 centimeters or 2 inches farther after the urine flows through it. If the catheter accidentally contacts the labia or slips into vagina, it is considered contaminated and a new sterile catheter must be used. The contaminated catheter may be left in the vagina until new catheter is inserted to help avoid mistaking the vaginal opening for the urethral meatus. Hold the catheter with the non-dominant hand. For an indwelling catheter, inflate the retention balloon with the designated volume. Pull gently on the catheter until resistance is felt to ensure that the balloon has inflated and place it in the trigone of the bladder. Collect a urine specimen if needed. For an indwelling catheter pre-attached to a drainage bag, a specimen may be taken from the bag this initial time only. Allow the straight catheter to continue draining into the urine receptacle. If necessary or open system, attach the drainage end of an indwelling catheter to the collecting tubing and bag. Examine and measure the urine. In some cases, only 750 to 1,000 ml of urine are to be drained from the bladder at one time. Check agency policy for further instructions if this should occur. For an indwelling catheter, secure the catheter tubing to the thigh for female clients. Wipe any remaining antiseptic or lubricant from the perineal area, replace the foreskin if retracted earlier, and return the client to a comfortable position. Instruct the client on positioning and moving with the catheter in place. Now, Ma'am Princess, I will now move you into your comfortable place, okay? Discard all used supplies in appropriate receptacle. Remove and discard gloves. Perform hand hygiene. Document the catheterization procedure including catheter size and results in the client's record using forms or checklists supplemented by narrative notes when appropriate. In evaluation, notify the primary care provider of the catheterization results, perform a detailed follow-up based on findings that deviated from expected or normal for the client, and teach the client how to care for the indwelling catheter, to drink more fluids, and to provide other appropriate instructions.